29th, I get the call that is unexpected and devastating. I get the call that my twin sister had been in an accident. And what my family and I quickly came to realize in the weeks and weeks of hospital visits was that it was much more easier for us to find a place to stay and book flights rather than it was to understand what were the best options for my sister and her care. Now, my family and I are not the only ones experiencing challenges navigating this very complicated healthcare system. There are many others in this country that are also having the same or similar challenges while trying to navigate this complicated healthcare system and having their needs go unmet. I've professionally worked at federally qualified healthcare centers, working with families and individuals that are trying to get their needs met. I've also worked with and for health tech startups that are trying to provide solutions for patient pain points as well as healthcare systems. And one of the common trends that I've noticed from my professional and personal experience has been that we as a nation need to start paying attention to social determinants of health. Health affects all of us. Therefore, we should all be interested and invested in what is going on in our healthcare landscape. My name is Zimri, and today I will be talking to you about investing in our health. So when I talk about social determinants of health, what do I mean? Well, according to the CDC, social determinants of health are non-medical factors that have an impact on a patient's health outcome. So if we take, for example, taking into consideration an individual's healthcare quality and their access, their education quality and access, their community context, economic stability, as well as their built environment, it all has an impact on that individual's health outcome. With that being said, social determinants have a big impact on patient outcomes as well as their care that they receive. And social determinants of health are actually becoming increasingly important in healthcare today. So, why does it matter, and what would be compelling about a social determinants of health startup? Well, in order to understand why it matters, we would need to understand a little bit more about our healthcare today. And let's start to answer these questions with a few facts about our healthcare in this country. It's estimated that clinical care is less than 20% of what impacts a patient's health outcome. The majority of things that will impact a patient's health outcome materially will occur outside of the doctor's office. 50% of social determinants of health have an impact on patient outcomes. And yet, most of the 3.5 trillion US healthcare spend is spent at the clinical setting. One of the biggest highlights of the global pandemic has been that this healthcare system is messed up. And because of that, it has resulted in an upsurge of technologies trying to address that. The pandemic has also accelerated the adoption of health tech solutions, and it has completely transformed the healthcare market. The pandemic also ended up showing an imbalance in our healthcare system, and quite frankly, it also showed the inequities that it causes. There would be an estimated $135 billion that we could get in economic gain if health disparities were removed. So why now? Well, startup entrepreneurs are actually having the perfect combination. They have an urgent problem and impacting a large demographic. You have a large market size in terms of dollars spent, and you have a window of possibility as well as the possibility of building a scalable solution. With that being said, we've also seen it before. For example, we've seen successful companies that focus on social determinants of health, One example of that is GoodRx, a company that focuses on bringing price comparisons for prescription medication. They were able to raise over 1.1 billion before they went IPO in 2020. And they have been able to, on average, help the consumer save 81% of cost on their prescription medication. If we think about that, that has a big impact on our population. What that means is that they're able to save and they're actually able to get the medication that they need. And in terms, that is helping their health outcomes. And in return, that is helping us spend less on their health care. And I know a lot of us, not all of us, can quit Shark Tank and sell our NBA team like Mark Cuban, but we can start small. We can start here in Chicago's very own backyard. Here are a few startups in Chicago that I've been able to talk with that are focusing on different social determinants of health. And if you'd like to get connected, we can talk more about how you might be able to help them bring solutions to our very own Chicago community. First off, I am doing this for my family. I'm doing this for my community, but I'm also doing it because it's a good thing. But I know as investors, we don't just want to do a good thing. We also want a return on investments. And social determinants of health startups can also bring good returns. So my call to action is to diversify your portfolio and invest in more health tech and social determinants of health so that together we can invest in our health, we can invest in our future. Thank you. My name is Zimri, and please feel free to scan the QR code to set up a meeting with me or meet with me via email. Thank you.